for him. Tell me what your questions would be, or what you believe the treating physicians would be prioritizing at this moment.
Well, first of all, Nicole, thank you for having me. And I trust that Charlie Kirk is getting the best care possible. Utah has some of the best hospitals in the country. And I'm praying for his recovery, as I know we all are. The questions I would have, yeah, I had a chance to look at the video. It was a direct, what I saw was like a direct bullet impact to what looks like the medial part of the neck. So the front part, the middle part of the neck. What you worry about, and what I'm sure the surgeons that are attending to Charlie right now are dealing with, are massive bleeding. This is a vascular part of your body. There's big arteries, there's big veins, they're big, and they are really the conduit between our heart and our brain. And so this is critical to make sure that if there's vascular injury, Nicole, that's controlled as quickly as possible, to preserve Charlie's brain function, and then also just to make sure that he doesn't bleed out. So that's number one. Number two is going to be airway compromise. If that was a direct hit to the middle of the neck, which it looks like it was from afar, I worry about his ability to breathe. And so they're probably going to do an immediate cricothyroidectomy, which is they're basically going to put in an airway directly into his windpipe, circumnavigating and basically detouring away from the site of injury. And so expect that he's going to have a tracheotomy, which is, many of your viewers, I'm sure, are familiar with from a loved one, or they've seen it. And then, overall, a spinal cord injury right behind our windpipe, Nicole. Not far behind that is basically the vessel, the esophagus that takes food to our stomach. So I worry about GI impacts, and also behind that is the spinal cord. So this is, it goes without saying, a major injury, gunshot injury, high-speed injury to the neck is incredibly dangerous. It's life-threatening, and his surgeons have a lot that they're dealing with right now. But really, the initial first response here is going to be, is his airway intact? Can they get the tracheotomy in place? I'm sure that was done actually in the field by EMS. And then controlling bleeding. Those are going to be priorities 1 and 2.
It's really hard to listen to any of that. This is someone who advocated politics and policies that I didn't agree with, but I would stand here until the end of time, defending his right to do so without any threat of violence, without thinking that speaking to a group in this country in the middle of the day in a college campus should be something that would bring about an injury like that. And I